We must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I'm joined today by good friend and now peer, Dr. Peyton Sykes. Peyton, how are you? And tell us a little bit about yourself, man. Give our audience a little intro.
Oh, man. Thanks for having me. I'm doing great. I appreciate the opportunity to talk education. That's, I could go on forever. A little bit about me. I graduated PT school in December 2014. Worked a couple years in outpatient orthopedics, did a residency, did a couple of years in travel, mainly acute care in hospitals. During that time, started working as an adjunct faculty and worked my way into a full-time position. And here I am, an academic. So yeah, that's where I am now.
Yeah, Peyton and I's paths have crossed several times now over the last couple of years. Peyton does a lot of good work with advocacy, and he's done a ton of work with just trying to get direct access in the state of Texas. That's been an uphill battle for quite some time, and we're starting to make a little headway, but we still got a long way to go. But one of the main reasons I've got Peyton on the show today is both he and I are involved in the educational doctorate, the EDD. I've completed mine in 2018 through the University of St. Augustine, where Peyton and I are both employed currently. And Peyton is actually in the Baylor program up here in Waco, where I'm at now. It's neat to see his educational journey kind of transform and which way it's heading. And we're here today to talk a little bit about the educational doctorate. And one of the first questions I kind of want to ask is, what would you say is the difference between an EDD and a PhD?
Ooh, good question. I might not be the best person to answer this because
That's all right. Perception is fine too. We can go with what you see the perception of differences.
Yeah, I had such a bias. Once I knew that I was going to do the EDD, I was going full steam ahead. And I had this sort of image, a PhD, meaning I was going to sit in a lab and study the rotator cuff, and I'm not knocking that at all. We need people to do that, right? I'm just not that guy, right? I was way more interested in the art and science of teaching, and not only for teaching in, the classroom, but how that would translate into, patient education, and then how that would translate into public education in terms of, the advocacy stuff that you mentioned earlier. So for me, all the interests that I had going on really funneled into, the EDD making the most sense. I would say that based on my perception, again, I think an EDD is going to lead you down more of the psychology and the learning theory aspects of a doctoral degree, whereas a PhD is, and there's so many different variations, right? Because you can get a PhD in education. I've always sort of perceived it to be more experimental, like you're doing an experiment to further the knowledge of how certain practices or interventions, work, basically. And I don't know if that's 100% true, to be completely transparent, but that was my perception. And again, why I sort of leaned one way versus the other.
Yeah, you hit on a lot of good points there. And I think I definitely agree with you. I think the EDD to me was more about theory behind how we teach, and more importantly, how we learn. And I wish that I had a lot of the knowledge that I gained from the EDD back when I was even an undergrad, because I didn't know how to study. And I know that now. I did it all wrong. I was literally rote memorization, rereading things over and over and over again, and it wasn't learning at all. And I went through my whole undergrad like that, which I was an English major, so there was a little leeway there. I had a lot of reading and writing that I could do and get away with it. But when it came to like math and science courses, those were a little tougher for me because I wasn't learning the theories and I wasn't learning the systems. I was trying to learn facts and memorize facts, and that just didn't work for me. I wasn't a strong test taker to begin with. So not knowing how to learn and not knowing how, my teachers were trying to teach us made things just even worse for me. So, but I agree. I think there was a lot of theory and experimentation behind our methods to teach and to get our points across and to transfer knowledge. So I very much agree with you there. Another point that I kind of wanted to touch upon, and this, again, is perception, but do you feel like there is a discrepancy or I don't want to call it a bias, but do you feel like PhDs kind of look down upon EDDs? Are you seeing that at all in the world of academia?
I haven't experienced any of that. Now, I will say that we're severely outnumbered, right? I mean, but I think that sort of goes with, the natural inclination. I mean, you get into the field of physical therapy to be a physical therapist, right? And then, I can't speak for all physical therapy programs, but, in my experience and from talking to other people who have been at other programs, we're really good at training people to be clinicians, right? That's what we want. We want them to be clinic ready, by the time they, pass that NPTE. But we don't spend a tremendous amount of time anyways, fostering those other professional career paths, and whether that be the business side of it or the terminal degree side of it, or, whatever that is. So you hear a lot of talk from students about residencies and fellowships, which again is more clinical practice. You don't hear a lot of students asking about, well, what do I need to do to be a teacher, right? Or what do I, why get a terminal degree? Right. I mean, and I think an unfortunate part of that, that we're dealing with, at least in this country, is the student loan aspect, right? I mean, when you're coming out with a DPT and a massive mountain of debt, the thought of adding another degree's worth of debt on top of that just seems ridiculous. It seems ludicrous. And so, I would say that, going back to your question, I think when students do understand that or I should say clinicians, physical therapists just in general, when they do start to discover those other professional pathways, it only makes sense, right, to bridge your clinical practice with what you're going to be learning in a terminal degree program. So I see that sort of as a more understandable or a more clear path, right, to go down the PhD route, as opposed to, the EDD. My view is the EDD is extremely versatile, but I could see where the perception becomes, well, that limits you to teaching. I don't think that that's true, but when you look at it on the surface, right, a doctor of education, you're going to be an educator, right? It just makes sense. So I don't see a sort of a prejudice or I haven't experienced that. People always ask, what's your study? What are you doing? Why are you doing it? And then I think once you tell them, it makes sense and people get excited for you. So I've not run into that at all, but I'm in a bubble, I guess.
Yeah. Well, so, for me, I've definitely experienced a little bit of bias, to people with PhDs. They feel it was a more rigorous dissertation and, study. It may very well have been, but I think I was a little worried at first, after I had gotten deep into the EDD, that I was like, I don't know what I'm going to do with this thing. I don't know how I'm going to leverage it. But we had Chad Cook on the show many, many episodes ago. And the one thing that he said was he found EDDs exceptionally useful because they were great at curriculum development and were able to kind of fit the puzzle pieces in and see the 30,000 foot view instead of just their one niche and their study that they did for their dissertation. So, where PhD might be all about the shoulder, and you're just a shoulder expert, we're taking that step back and looking at the whole program, the entire curriculum, seeing how pieces not only fit, but interact with each other. And, we can help create those, the syllabus and build out the curriculum and help with overlap here and there and where things make sense. So, that was comforting for sure.
I completely agree with that. And I think, at the risk of offending somebody, and I certainly don't mean to, but, PTs are really good at being PTs, right? They're really good at being physical therapists. And my fear is that there's a large assumption that's made that, okay, well, if you can educate a patient, then you can educate 30 students in a classroom or 60 students, however large your cohort is, right? And to some degree, I mean, you have to have, I've often wondered if sort of communication and empathy are just natural prerequisites to being a physical therapist, right? And that can get you a long ways. But as you mentioned earlier, there's an art and a science to education, just like there's an art and a science to treating the shoulder. And, if you're not conveying that, you could be the biggest expert in the world. And I tell students this, I said, if you could know every rehab technique and all the evidence about what exercises are going to be best for the shoulder, but if you can't motivate a patient to do that or build rapport with your patient, you might as well be talking to a brick wall. And so I think that if there is, going back to your other question, if there is a prejudice, it's sorely misplaced, because I view my EDD as sort of facilitating that process of, okay, you're the expert, right? And I'm not questioning that you're the expert on the shoulder, right? But how do we put that information in a digestible format so that this student who's coming up behind you can not only be an expert in the shoulder, but also advance what we all know about the shoulder, right? And I think that's where, to Chad Cook's point, right, the understanding of how learning really takes place and how to best facilitate that process is a key piece that honestly I wish we had a little bit more of in physical therapy education as a whole.
Right. And it probably even goes way before then, even back to just critical thinking, and take that back to high school even, but to touch on your point earlier, you were, I think even going further than just being able to motivate our patients by educating them, we also need to be able to know how to educate the public to market ourselves so that they know where we exist, right? And what we do, and that we can be an answer to their solution. Again, we just don't get enough business and marketing education, so to speak, in PT school. There's just not enough time for it as of right now, the way that the test is structured. So, there's a lot of education that has to go on, but let's even take it a step further and look at the why behind getting into an EDD, right? When I looked at it, when I weighed the options, for me, the EDD made sense because, again, I thought I was going to teach later on down the line in retirement years, and I figured if physical therapy were to crumble to the ground, I could still teach general education, right? K through 12, or just the theories behind how we teach and educate. So the EDD for me was, like you said, kind of a no-brainer, because I wanted to learn more about learning and teaching, and I needed that. Because again, the stuff I learned in my EDD would have been way helpful to me back in the day had I known. So tell us a little bit about your why and why you got into the EDD program and how that's going so far.
Yeah. I mean, obviously everybody's journey is going to be a little bit different. In mine, I can think of two instances that really sort of steered me down that path. And I mentioned, I was working in outpatient orthopedics. I did an orthopedic residency. I was really, really lucky, but I also fought really hard to get those opportunities to learn and to work with some really exceptional physical therapists who were fellowship trained and really helped me understand and elevate my orthopedic practice. And so I spent a lot of time working on that, clinical knowledge and orthopedic knowledge. And I took a class, continuing education class with Adrian Lowe. And that class, he's known for pain science, right? But the thing that I took away from it, I always felt like I was good at talking to patients. I was good at building a rapport, and I could always fall back on that, but I didn't know why. I didn't know why I was good at it. I didn't know, again, it goes back to that, is it just a matter of being nice, or, what's the thing that motivates a patient, And so, for me, the thing that I took away from it was the psychosocial aspects of, again, motivating a patient, understanding their motivations, understanding their facilitators and barriers to getting better. And so that was where it really sort of started, because we hammered on the biological part, right? If you're thinking biopsychosocial, we hammered on that in school, but we didn't really get a lot of that. And of the other, the psychosocial parts, at least not in I'm sure it was, scaffolded and sort of threaded through, but not in a structured way that made me recognize that this is what it was, And so that was probably one of the big turning points. And then, as I mentioned, I was working adjunct while working in the clinic as well. I was teaching in the weekend labs, the Flex program. And obviously, I developed a big passion for teaching just in doing that. And, the guy who was running that program at the time was a mentor of mine while I was in PT school, Dr. Tom Werner. And when a core faculty position came open, he facilitated that process of applying for the job and tasked me with giving a 30-minute presentation on learning theory and how it applies to online learning. And, I tell him even to this day, every time I talk to him almost, that he knew exactly what he was doing because he knew my interest in sort of the psychosocial components and how that fused with, a love of teaching. And I didn't even know learning theory was a thing at the time. So I had 2 weeks to read a book that was as thick as a brick and Google what I could. And it completely opened my eyes, again, going back to that sort of art and science of teaching. And when I looked at, at that moment, I knew that I was interested in that aspect of furthering my education. And so when I made the decision to do a terminal degree, I had to find, okay, what's going to be the best to tie all of my interests, all of my passions together. So, a lot of serendipity here, but, as you mentioned at the time, we were heavy into the advocacy, during the Texas legislative session. And so I saw, as you mentioned, educating not only patients, educating not only my students, but also educating the public, educating other people in our field to help understand what's going to be the most effective way to, make a difference basically in our advocacy efforts. And then, again, going back to, what's the best way to reach 30 students who are sitting in front of you? How do you facilitate the learning? And, how do you, I think part of that was I just didn't want to do what was done for me. I didn't want to just mimic the teachers who taught me. I wanted to understand what was going to be my style, or why were the things that I were doing, effective or not effective. And so, yeah, again, with all the different aspects of my life, even for a while, I was doing a cash-based mobile practice, right? And marketing is nothing more than educating, right? So, it just seemed to fit. I could tie everything that I had a passion for into, learning more about education and how people learn. And so that made sense to me. I would encourage anybody who's going to do a terminal degree to think of it in that way. You could be interested in 1,000 different things, but if you can't find something that's going to tie the majority of those together, then you're going to feel very spread out and you're going to feel very, worn thin. But if you can find that thing that ties your passions together, whether that's an EDD, PhD, or whatever it is, then it's going to make it seem a lot less effortless.
Yeah. Well, let's dive into that a little bit then. Let's talk about that. So the PhD obviously is a terminal degree. The EDD is also a terminal degree, right? We need these terminal degrees in theory to fill out a lot of our core faculty, because CAPTE has these guidelines that they want us to follow, where at least 50% of the core faculty, correct me if I'm wrong, has to hold terminal degrees.
Yeah, that's correct.
So for these PT programs, and there's a ton of them rolling out lately, which that's a whole nother episode for a whole nother day, but there's just a ton of openings for professors that they're going to need. Now, that being said, don't get me wrong, it is still very competitive to try to get a teaching position, right? Because there's 220 programs in the nation. Each one has 8 to 10 faculty. So you're looking at maybe 2,000, 2,500, maybe. And again, this is core faculty, full-time teaching positions. And there's 300,000 physical therapists in the nation. So, even if just a portion of them want to teach, it gets pretty competitive, right? So the terminal degree helps for sure. You fill an instant void needed by the university to meet CAPTE standards. But, moving beyond that, these universities, once they've picked all their professors and they've got their terminal degrees in place, as we keep rolling out these new programs and people, there's going to be a big wave of retirement coming up soon too, because there's a lot of professors in that, baby boomer range where they're just getting ready to hang it up for the career. So what are we going to do about filling the void of terminal degrees for a lot of these programs. How are we going to get DPTs that have already, like you said, spent a ton of money on a degree to spend more money on a degree? Because you could do a PhD and maybe get it funded, and that pays for your research and everything, and you're, good to go. But EDD, there's not a whole lot of money out there for educational research. So, what are some inventive ways? What are some things you think we're going to need to do in order to help garner interest in terminal degrees? Do we need terminal degrees, right? I mean, like, what should, DPT programs loosen the reins a little and CAPT loosen the reins a little bit? What do you think we should do as far as the terminal degree issue is concerned?
So there's a lot of different ways, because that's not an easy problem, right? And there's a lot of different ways to approach that. And so, I'll do my best to try to, make a few succinct points if I can. But I may be in the minority here, because I've seen a lot of discussion and a lot of frustration at the move towards a DPT, right? And, there's a lot of blame for the student loan debt that goes towards that movement. I'm in favor of the DPT. I know that even across the pond, so to speak, it's sort of a funny notion to foreign PTs, because, they get done with their PT degree as basically an undergraduate degree, and they have a different sort of autonomy legally than we do, in most cases. And so they don't see the need to call themselves doctor. I think we've moved to that state, right? You can't put the rabbit back in the hat, right, so to speak. And so we can argue the merits of a DPT on a different episode, I'm sure. But in my opinion, if you're going to have somebody who's going to teach physical therapy, in a DPT program, then it makes sense to have a degree higher than the degree that you're teaching. And so if you're teaching DPTs, then what's above that? And I don't think it's just because of the letter aspect. I think it's because, again, I think traditionally, even within our profession, physical therapy is looked at as sort of an apprenticeship style educational delivery model. It's, you have clinicians teaching clinicians, right? This is what I've seen work, and this is what I want to teach other people to do, so that they can, make it work too. But if you're not at that level, that doctoral level of really critically thinking about, well, why does this work? What does the literature really say? And, how am I contributing to that body of knowledge? Then I find it really hard to have the credibility, and I'm saying this about myself, right? To stand in front of 30 other people and say, look, I've spent the time to really understand, and from multiple perspectives inside and out, what this knowledge means and why it's important for you in your clinical practice. And so in that light, I do think that, I think that the 50% requirement is a good one. I personally think that, going back to a point that you made earlier about sort of the discrepancy between EDD and PhD, I think that it only makes sense for a university to have a team to develop a course that consists of, a clinician who's out there in the field getting their hands dirty, so to speak, a PhD who's done, the research on the knowledge aspect of the content that's being taught, but then also somebody with an EDD to help package all of that in a digestible format for the students. So for me, what I would like to see CAPT do is, okay, 50% of your faculty have to have terminal degrees. Well, 50% of that 50%, or 25% of your faculty total, need to have an EDD. And, again, we're in the business of education. It only makes sense to me. I think, that would drive the quality of our education, forward in a tremendous way, in my opinion. Now, again, that doesn't really solve the issue of, again, students graduating from PT school and being willing to take on more debt to get a terminal degree. I mean, that's a whole other, set of problems. I think that, that we could dive into, and again, in a multiple different ways. I think, we could talk from everything from, legislation on interest rates. I don't understand why a government official can borrow money at 2%, but somebody who's trying to get an education to better themselves is sitting at 5 to 7% at best case scenario. And I mean, when I came out of school, I had a private loan because, again, as you mentioned, like, I didn't have the financial knowledge. I was financially illiterate, as some people like to say, and I didn't understand the difference between private loans and public loans and consolidation versus refinancing, right? So, my first loan was a private loan and my interest rate was 11.25%. I mean, that's absolutely criminal. How do you expect? I mean, I don't mind saying it, right? Anybody who thinks that they can justify that for somebody who's trying to get their education, there's a special place down south for those types of people, in my opinion.
Yeah.
But again, I think that's, is that going to solve the student loan debt, right? Capping interest rates at 2% for any educational loan? No, but it would be a tremendous step in the right direction. So I mean, we can talk about it from that angle. We could talk about credit hours and how, tuition is calculated. That one's going to be a tougher one to solve. But, in terms of the terminal degree thing, I do think, going back to your question about influencing people to choose an EDD over a PhD, I do think it's an extremely valuable and necessary component if you're going to be an educator. I do think you have to have those people within the educational realm who understand the art and science of teaching. So if CAFTE stepped up and said, hey, we need X amount to be this, to have this type of training, I think it would go a long way.
Yeah, and I think, we could even look into things like grants from CAPTE or, the educational section, or to get people, who maybe weren't involved or couldn't afford it to have a chance, to have an option. There's, we've talked before on several episodes about maybe a bridge program where you stay a fourth year and some of your courses from the DPT overlap into the EDD or a PhD. I want to say Texas Women's University has something like that, where there's a PhD program available if you stay on another 2 years or something.
You're seeing some like residency and fellowship programs who are attaching a DSC, which I think is that's a much cheaper option, and it's clinical, relevant. So, I mean, I think, again, it's not an EDD, but it's a terminal degree. So exactly. I think people are exploring those avenues, which I think is great.
I definitely think there's a need. And kind of going back to your point, and what I've experienced, once I finished the EDD, and I was worried for a while there because I wasn't sure what I was going to do with it, but I was able to leverage it into educating the way I wanted to about the things I wanted to. So I've created online courses. I've written a book about how to pay down student loans quicker. I've taken the knowledge from my EDD and turned it into things that I enjoy doing and I enjoy educating about. So it's not even just physical therapy school now that I'm educating, but I'm educating on the things that I truly love and want to educate about. I mean, it's just about how you leverage it. It really is. So it can be done. It obviously can be used for teaching. That's a great aspect, but you can also leverage it into a bunch of other things. And I think a lot of the opportunities as of late that I've had come at me were 100% just because I had those letters after my name. The door wouldn't even have been opened had I not had the educational doctorate. Now that I do, I'm able to kind of say, oh, by the way, I've got this educational doctorate too. So I can help teach, for instance, like a consulting gig on, ergonomics and proper body mechanics and proper lifting. I can go into a company and say, I can help educate your people, because I'm a physical therapist, but absolutely. I can also help educate because I have this EDD. So I know how to put together a group class and show your entire staff how to do this stuff so that they don't get hurt and can prevent injuries, things like that. It's just connecting point A to point B. And like you said, tying it all together. That's helpful in the bigger picture.
One of the things that, my dad always said to me whenever times get tough, right, is, you're always going to be okay because you've acquired this knowledge. The bottom could drop out, right? You could lose your license for whatever reason and you couldn't treat, but nobody can take away that knowledge that you have. And so you can spin that into a useful trade, if you can just think creatively about it. And so that's exactly what you've done. And that's, like you said, education is not specific to formal teaching, right? And I think another misconception, and one of the things that I'm really excited about being in the program that I'm in is that you don't just have K through 12 teachers, or you don't just have teachers, right, who are taking an EDD program. So I'm in a cohort with people who, one guy's in oil and gas, another guy's in HR, right, for major corporations. There's one girl who works to do safety training for the mining industry. You have people from all walks of life. I'm not the only healthcare professional there either, so you get to hear perspectives from all walks of life. And again, these people are leveraging their education and gaining more for it to be able to do a number of different things. And so to your point, I think it's a highly versatile degree, as opposed to studying one concept, right? Obviously your dissertation or your research is going to make a name for yourself, so to speak, but having that understanding is powerful. You can use it in so many different ways. And so I completely agree with you. I think that it's a highly versatile degree to have.
Yeah, well, let's talk about your program a little. I obviously had gone through St. Augustine's program. It was about 6 to 8 didactic courses, 2 of which from the DPT, the transitional DPT, overlapped. So those helped out with knocking down the amount of courses I had to take. I then had to do 2 in-person teaching residencies down at the university, and then my dissertation. The courses were great. I love the didactic stuff. Like I said, I loved learning about learning theory and how to teach and how to learn and all that. That was great. I enjoyed that. The teaching residencies, phenomenal. I love them. I got to be in the room with 20 other people learning about methods and things that helped with teaching. My roadblock was the dissertation. That was just awful. I don't even know how to say it other than I would not wish it upon my worst enemy, So congrats. You've got that to look forward to. But tell us a little bit about your program. How's it laid out there at Baylor?
Going right at the elephant in the room, so to speak, is the dissertation. There's multiple ways. And again, I didn't know this going into, even looking at terminal degrees. I was under the impression that the dissertation was always just sort of reserved for the end. You learn what you learn and then you apply it later. And the thing that drew me to Baylor's online EDD program, not that I'm advocating this program for everybody, but I will definitely wave the flag in terms of I think I'm getting exactly what I wanted and it's worth the money in my opinion. But the thing that I liked about it was they take a problem of practice type of approach to a dissertation. So your entire curriculum is built around this concept of you having a problem in your own practice, no matter what that is, that you're trying to either better understand or to solve in some way. And so every course that you take is developing, the assignments are developed around your personal problem of practice. And so just starting out, we took qualitative research and we're writing essays about our problem of practice. And now I'm into the second year and I'm looking back at those same assignments and drawing from things that I've already written to fill into my drafts of my dissertation already. So the thing that I loved about this program is that it's not okay, now we're done with you in the classroom. Now go write your research. You're continually writing it throughout the entire program. And it's scary at first because you have no idea where it's going, but it all ends up, you look back, or at least I have now about halfway, and I'm like, man, this all makes sense. And I'm able to draw from all of these things. So, I think you have to find, again, a program that works for you in that way that speaks to what it is that you want to accomplish. And, for me, my program, I spent a year actually looking for this program because I knew I wanted a program that emphasized learning theory. I wanted an EDD that didn't limit itself to K through 12 education. And, I just, again, very serendipitously found that, that the emphasis of the EDD at Baylor is learning theory and organizational change. So, when you think, again, back to the advocacy efforts that I was involved in, it just made sense. And not only that, right? Who doesn't want to help the organization that you're a part of? And so those things played a big role into my program, as well as the fact that it's a cohort model. I didn't want to go through an online program by myself. I didn't want to be on an island. I wanted to have people that I could bounce ideas off. And that goes into learning theory, right? Adult learning theory is you learn best by not only, attacking the information or the knowledge yourself, but gaining different perspectives from people around you and that's sort of that metacognitive piece about learning. And so it was important to me to go through it with other people and to have those people to bounce ideas off of. And, the Baylor program definitely does that as well. So, again, just like PT school, there's variation, right? And I think you have to find what works for you. Not everybody needs a cohort model, right? So you might not find that that's extremely valuable. For me, it was. So
give me a rough estimate timeline on what you think it'll take from start to finish.
It's designed to get you done in 3 years.
Nice.
There's some wiggle room. It's a full-time program. You're taking 6 to 8 credits every term. And so, it's like having a second full-time job. You can drop down to 1 class a term. People do it and they're doing just fine. So I don't want that to be a scary notion, but you can really tell in this program how the courses feed off of each other and build on each other. They really do enact the principles of learning theory. It scaffolds, it builds on itself. And so a lot of times the assignment that you're doing in this class over here is going to be the same, or it's going to at least,
carry over.
connect, right? Yeah, to the other class that you're taking at the same time. So, I mean, 3 years, is sort of the design, but you can certainly take a little longer if you need to.
Awesome. Well, Peyton, I can't thank you enough for taking your time and coming on the show today. We ask all of our guests this one final question. If you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change and how would you change it?
Ooh, man, what a great question. What a fantastic question. I think we've reached an age where we have to really critically think about the utility of what we're teaching, right? And one of the biggest revelations that I had in my program was, we took a class called Social Foundations of Education and realized that public education was born right at the same time as the Industrial Revolution. So if you think about the way, in all aspects of education, the 8 to 5, 40-hour a week model of education, right? Or, it's 8 to 3 or 8 to 4, when you're in K through 12 or whatever. But it's all built around the same principles of training somebody to go work in a factory and do a efficient job, right? And that's not the way that life and careers and things work in the present day. You have a higher need for critical thinking and innovation than we've ever had. And with technology exploding, that you can call it the technological revolution if you want, but I think that it's hard even for times like people in our profession of physical therapy to welcome that, because it still seems like you need to have this foundational knowledge, right? But, why can't we, teach sociology and history together? Why can't history be tailored towards, current events that are going on? Why can't we teach it backwards? This is what's happening in the world now. Let's look at the historical events that led up to this, right? And provide context and meaning. I think too often in higher education, particularly in undergrad, I was, thinking about this as you mentioned it earlier, the prerequisites that I took for PT school didn't really mean much to me, right? I took 2 chemistries and I've never had to create a formula in PT school. I took 2 psychologies and I wish that those were more reinforced in PT school. So why do we teach, or why do we have anatomy as a prerequisite and then teach it again in PT school? Are we teaching it differently? Is it different anatomy? Why can't we teach more applied anatomy? Why can't we teach biomechanics and the functionality of anatomy and just get away from, and that might, I'm going to make some people upset with that one. But I think, again, the point is you have to reconceptualize the utility. What is this knowledge going to be good for? What meaning does it hold for the learner? And I think if you ask yourself that critical question, then your instruction becomes better, right? Your the meaning that you attach to your instruction becomes deeper, right? And you provide more real application, in our instances, clinical application, right? So for me, that was a sort of a broad answer to give, but I think my challenge to anybody who's in higher education is to critically think about that. Are you doing it because this is the way it's always been done? Or are you doing it because it's really going to be meaningful for the person who's sitting in that chair in front of you?
Yeah, I think that's a great insight, Peyton. And, it's really one of the more in-depth answers that we've gotten over our many, many episodes at this point. But where can people reach out to you and follow up with you if they have any other questions or just want to chat about education and EDD programs?
Yeah, I'm on, I'm on all the socials, right? So you can find me there. I'm on LinkedIn, so you can grab my contact info there. I'm not hard to find.
Well, thank you again for your time, man. I really appreciate it. It's been a great chat, and I look forward to working with you.
Yeah, thanks for having me. This is a blast, man. I appreciate it.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available on our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.